Welcome back to 90 Day Dental Day 18. So we've finished Smile Design, we've finished occlusion, and we've tackled TMJ and muscle analysis. So naturally, the next progression for us will be the analysis of deprogramming and looking at the options for occlusions that are a bit more tricky. And we're going to delve into that even further by talking through with Kathryn Dunning. Take it away.
Hi, so today I'm going to talk about deprogrammers. Anterior deprogrammers that are used to stop bite problems. I find personally that I've used them for several years. They help patients significantly to relieve symptoms of temporomandibular joint problems, headaches, migraines, and in doing so also helps to protect the teeth. So I want to go through why I use them, how I use them, when not to use them, when to go to different other types of appliances, and which ones to use and when and why. So deprogrammers are a type of bite guard. They only permit the front teeth to bite. They take pressure off the back teeth, and in doing so take the pressure off the muscles, and therefore decrease the maximum loading onto the joint and associated muscles. They're designed to also allow freedom of movement in anterior protrusion and lateral movements, and thus allows the jaw to relax, and particularly the lateral pterygoid, which is the elevator muscle, which then allows the joint to seat into the most comfortable position. Why do we use them? They can be used to help with severe bruxism, occlusal trauma, headaches, migraines, and to actually record centric relation when we then want to actually restore in centric relation. As I said previously, it helps with any disordered function of the muscles and the temporomandibular joint. When do we not use them? If there is intracapsular pathology, a suspected chronic anterior disc displacement, any pole, medial lateral clicks, any joint pain after wearing an appliance, and then we have to look at a different type of appliance, which we can go through at a later date. When do we actually find that we need to be providing this type of appliance? When we can see a damaged smile, when we can see that there's repeated fractures of teeth or fillings, when there's damage occurring to composite veneers, or porcelain crowns, if there's failure of dental implants, periodontal conditions that are aggravated by the occlusion, headaches, migraines, jaw and neck pain, an increase in facial muscle, the masseter muscles, if you get an increase in the corner of the lower jaw. So in terms of the primary requirements, when we're looking at occlusal therapy and the design ideals for deprogrammers, what we want are comfortable and stable temporomandibular joints, for the anterior teeth to be in harmony with the envelope of function. And what I mean by that is, if you imagine if your lower teeth are biting into a deep bite, they have to excurse from below the cingulum plateau all the way into the cingulum plateau and then forwards to then disengage. And so if the bite is too deep, that can cause problems because you haven't got freedom of movement in the anterior envelope of function. And also what we don't want is we want to remove the interferences in the posterior teeth. So the posterior contacts should not interfere with a comfortable temporomandibular joint, and also not interfere with the anterior guidance at the front. So what are the signs and symptoms that can happen with occlusal errors? We can get sensitive teeth, that can be either front or back teeth. Teeth may become tender to bite on, they can become loose, they can wear excessively. The mandible can then deflect around an interference, and other teeth may become worn as a consequence of that. Other teeth can become sore. You can get a forced deviation of the mandible, which can then cause the masticatory muscles to become tender. You can get trismus, in other words, the muscles can become very tight and not able to move freely. Muscle tension headaches can develop, and you can then get constant stress as a consequence of the headaches and pain that you're suffering. So at this point, if you had any of those signs and symptoms, but particularly the muscle pains, and then you put a soft bite guard over that, then that's going to actually exacerbate the problem because it's going to go over all those occlusal errors. And so that's when, unfortunately, if you then allow that to continue, you can get a combination of uncoordinated musculature You can get a displacement of the disc and even more muscle pain. And eventually, over a very long period of time, you could get degenerative arthritic change in the temporomandibular joint. But however, that is less likely as long as we intervene before then. So going back to deprogrammers, what are the types? We can use a sleep clench inhibitor, an SCI. Those can be made in surgery, or they could be made by the laboratory. I personally have used the SCI more than any other anterior deprogrammer. I've used the in-surgery type, and I've used the SCI Plus, which is made by the laboratory, which I'll go into in detail in a second. There's an SCI dual arch, which are really useful, particularly after orthodontic alignment, if you want to be able to keep the teeth in line and also prevent tooth wear. So that would be normally full upper and lower Essex appliances with an upper SCI or a lower SCI, and then the opposing arch would then have a slide bar to allow freedom of movement and then prevent any further occlusal changes and prevent any relapse of the orthodontic treatment. The other types of deprogrammers are the B-splint, which is advocated by Dawson, and there's also the Coys deprogrammers, Spears deprogrammers, Lucia jigs. There are various appliances out there.
The natural progression from this topic is to move on to looking at splint therapy and options. And even though it's a very vast and wide topic, Kathryn will be back with us tomorrow to go into a bit more detail on that and break down some of the different rules and options that are available. It's a very poorly understood topic, so we're very much looking forward to it and taking it further. See you tomorrow.